All right, our next presentation is Dr. Mark Lyte. Mark Lyte is a full professor with board certification in clinical lab medicine at Texas Tech University Health Sciences Center in Abilene, Texas, and an adjunct appointment with a full professor in the Department of Internal Medicine. He's a founder in the field of microbiology endocrinology, which seeks to understand how neuroendocrine hormones can interact with microorganisms in the maintenance of homeostasis, as well as the pathogenesis of infectious disease. He received a BS degree in medical technology, an MS and a PhD from the Weizmann Institute of Science, and he's been at Texas Tech since 2005. So we look forward to your presentation this morning.
Great.
Welcome.
Thank you. Thank you. Okay, so today I'm going to really take a very different tack from all the speakers we've had before and try to introduce a kind of a new topic to you, a new way of looking at the disease and bacteria, and hopefully a way of seeing it differently than what you've seen before. And what I'm going to do is basically introduce to you bacteria and infectious organisms as neuroendocrine organisms. I'm going to take the tack. Everybody here is, talking about cattle and all the rest and taking their side. I'm going to take the side of the bacteria and say, what is it about the bacteria that's different? And what is it that we're not thinking about the bacteria? So I'm going to try to do some paradigm shifting, hopefully, in the way you're thinking about disease. And I'm going to introduce bacteria to you as neuroendocrine organisms. And I'm going to, throughout this talk, give a very strong evolutionary slant to this talk, just saying, if these are commensal organisms, what are they doing to the cattle and why are they doing it? And what does it mean for infectious disease, especially regarding respiratory disease? Now, there's clinical evidence for 80 years that bacteria are neuroendocrine organisms, and I won't have time to go into it. I'll touch on it during the talk. But I'm going to ask to consider the microbiota from a neuroendocrine vantage point, because when you consider them as active participants, not from the way you've been told about them, but from a different way, as neuroendocrine organisms, then you're going to hopefully see a different way to look at your disease and hopefully institute different treatments. And this concept of bacteria being neuroendocrine organisms and interacting with us, cattle, and the rest has been termed microbial endocrinology. So what is microbial endocrinology? It's basically the union of microbiology and neurobiology, giving you this, and then how that impacts disease, and I will touch about brain behavior because it's been talked about how the cattle act once they're infected. So I'm going to give you a different slant on that as well, why they're acting the way they're acting. And evolution, as I said, is going to be a theme throughout. Now, this is what everyone's been taught, that stress affects immunity and affects disease. This is the way I started out over 25 years ago. And is that the complete story? I'm glad someone else showed some mice and not cattle, and I'll only show you this very quickly to say mice can be used not in restrained stress, but in a stress that cattle, pigs, and all the rest do go through, which you take a mouse, this black mouse, you put it with somebody new into somebody's cage, basically this is white mouse, and they fight, and they go with what's called the social conflict stress. So this mouse is really stressed. It's the intruder. He's in a new environment. He's been stressed. And what you think is, okay, I've been stressed, my immune system is going to go down. From an evolutionary standpoint, let me ask you a question. Does that make any sense? You are stressed, you are presented with an infectious organism, so you have been through evolution to be geared to say, okay, now I have the bug, I've been stressed, time for me to die, time for my immune system to go down. It doesn't make any sense. If you actually look at the ability of the animal's immune system and those compartments of the immune system that actually deal with infection on first-line defense, being the phagocytic cells. I'm glad Dr. Grable brought it up yesterday about how the immune system is actually increased upon stress. We reported over a quarter of a century ago now, so over 25 years ago, we reported the first data that mice which are stressed, their immune system is increased. Their ability to kill bacteria is increased. From an evolutionary standpoint, it makes sense. You're presented with an infectious organism, you want to take care of it. But yet, when we go to actually infecting a mouse or an animal with an infectious organism and the immune system is up, the animal dies faster. At that point, because the animal died faster, the question was, who does this make evolutionary sense for? For whom? And what Dr. Hilton brought up at the beginning, I immediately went on the web and looked at it. He brought up the thing about, from Timset's article, M. hemolytic-associated BRD episodes are due to predisposing factors that enable the resident flora to overcome the cattle's immune system. And what I'm going to show you is one of those things that happen is that you're not considering is the stress of the animal, but what does it do and what is the bacteria recognizing because of that? So, stress-immune interactions reconsidered. It was at that point, about a quarter of a century ago, I said, forget immunity. There is no immunity in an animal. On first-line basis, when someone is infected with 5 bugs and they swallow it, or an animal is infected with a certain amount of bugs, the immune system simply doesn't see it. In that whole huge panoply of all organisms that are there, of 20 trillions and trillions of microorganisms, how does the immune system see 5, 10 bugs invading in? It doesn't. The bug is there first. It's responding to the host. What is it doing? And so whose survival are we talking about? So as I said, I'm going to take the side of the bug and say, okay, now the bug finds itself going from the nasopharynx down into the lungs. It's a new environment. I'm going to take the side of the poor bug. It wants to survive. And so what is it going to do? What is it going to recognize? And our bacteria and neuroendocrine organisms. So let me introduce you to one thing about bacteria that you may not know about. They have hormones. They have neurochemicals. It's been known for nearly 100 years. Here's a partial list. GABA. Gamma-aminobutyric acid, the primary neuroinhibitory transmitter that's in your brain and all the animals' brains, are found in bacillus, lactobacillus, clinical bacteria pathogens. The probiotics that many of you give to cattle make GABA, prodigious amounts. And no one quantifies it or understands it. You all go about it in terms of immune capacity. Somatostatin is made by bacillus. Dopamine is made by Escherichia bacillus. Serotonin, acetylcholine. Whole things are made by it that we associate just with mammals. Even things like opioids. E. coli have 100% homology of the binding site for opioids that we have, the exact same binding site. These are not chemicals that are like what we have or cattle have. They're the exact same ones in composition. And there is an evolutionary relationship between microorganisms and the host. That when we speak of bacteria as neuroendocrine organisms, we're speaking of them as having the same signaling pathways we have. So when we talk about stress and the animal going through stress, or we talk about us making things like norepinephrine and epinephrine from L-DOPA all the way up the chain, guess what? Escherichia have exactly the same pathway we have. Not similar, the same one. The same cofactors, everything's exactly the same. Such that all of our signaling pathway systems that we have in our brain, the animals have, you find them in bacteria. They evolve from lateral gene transfer, cell-to-signaling, from bacteria. Which means that microorganisms, such as those in the gut or anywhere in the lungs, do not simply rely on traditional nutritive energy sources, glucose and the rest, for their survival. They are looking at factors within the host, just as they look at factors within themselves to tell them where they are, what should they be doing. So the concept that bacteria can actually look at neurochemicals, use them, view the host, is that you now have bacteria as an interactive player. I tend to put this as they're not dumb bugs. They're not 1 to 2, 2 to 4, 4 to 8. They are active, responsive organisms that have their own social hierarchy. They have their own social organization. And it's bidirectional. So they're responding to the host, we are responding to them. And neurochemicals are the pathway. And they are the common element. So 2 questions that emerge. Can bacteria in the host produce neurochemicals that influence the host? I'm not going to touch on that a lot today, but I will touch on, do neurochemicals produced by the host influence bacteria, per se, for infectious disease? And what that means is that the concept of microbial endocrinology implies a bidirectional response element. It's bidirectional. And I'm going to start out with the gut, but I'm going to go to the lung. Because there's so many similarities. When I was again, thank the organizers for inviting me to the conference. I was not really concerned with the lung much. I've been concerned with the gut because of the bacteria, the whole human microbiome project. So, but then when I got to see the lung, I'm going, there's a lot of similarities here. In the gut, the really neat thing about the gut is that there's an enteric nervous system. And people don't often think about this, that the gut has 500 million neurons in the gut. And that the important part is that many of these neurons project all the way into the villi such that they're right there at the tips of the villi. All this information is being gathered by the gut enteric nervous system. And 500 million neurons is as much as what's in the spinal cord. No one knows what they all do, by the way. Even on a clinical standpoint in human medicine, we don't know what they all do, but they're there. And even things like all these neurochemicals that we think are made in the brain or the heart actually are produced within the gut, such that norepinephrine and dopamine are in the mesenteric organs and can constitute over 50% of the total body, and that you are actively pumping out neurochemicals into your gut all the time. And we don't know why. We just don't know why, but they're there. And in animals as well. But when we go to the lung, when I said, okay, how about the lung? It was really interesting to see. I hadn't known this. The lung is innervated by adrenergic and cholinergic components of the autonomic nervous system. There is very limited data on what is a neuroendocrine environment. You keep talking about stress of your cattle. You don't know what the cattle are putting out into the lung itself. I contacted a number of vets about this at academic institutions. They asked me, get me some papers. I can't find them. What is the cattle actually making in terms of neurochemicals being pumped out? And the answer is nobody knows. The autonomic nerves consist of sensory afferents originally in the epithelium, the airways, muscles. The afferent neurons transmit information up to the vagus nerve and then back to the CNS and to the brain. And so when you look at the cattle and the innervation of the lung by the nervous system, you see that there's a circuitry with the vagus nerve, just like you have in the gut, and that you have innervation going right down to the submucosal level. And you're producing neurochemicals, and the animal's producing neurochemicals. There are, as I said, very limited studies about the stress effects that go on about there. And from a clinical standpoint, increases in lung levels lead to pulmonary dysfunction. We know that. But we don't know how they're interacting with the bacteria. So is there evidence that, I'll actually skip this one over, that bacteria will respond to the neurochemicals? And this is actually the first slide that was ever done in 1992, that when we did it, took the picture, to show you that bacteria will just increase dramatically when they're given a neurochemical. So here's your Yersinia enterocolitica. You put a little bit of norepinephrine with it, and it goes from here to that. The increase is millions of fold increase within hours, simply by putting a neurochemical. Forget the glucose. This is in an environment where you have limited iron and everything. This is not in your usual media. This is in a blood-based media, for example, very difficult. If you take bacteria like Y. enterocolitica and you simply treat them with norepinephrine and give it to a mouse, because we know it's very hard to get Yersinia enterocolitica to take in a mouse. This is what a control mouse looks with 10 to the 6 stuffed down it to get it to take. It doesn't take. We know this. Simply pre-treat bacteria with norepinephrine, let them grow in it, put the same amount or a little less bacteria in the gut, look at the huge invasion you get and the development of lymph nodes. It just turns them on in a way we don't understand totally. So they're 50,000 times more infective. Is there clinical evidence that this really occurs? That bacteria respond to the neurochemicals that are produced during stress? Well, back in 2003, we published about one of the things in terms of Staphylococcus epidermidis' ability to make biofilms on indwelling catheters in patients, which is always a huge problem. And we were able to show that in the case of physician do no harm, here's what a catheter surface looks like. You don't see anything if you try to put staph epi on it. But if you put dopamine on it with the staph epi, this is what happens. You make incredible biofilms, and it looks at what happens in patients, that you get infected catheters, so that the bacteria are responding to that. But do stress neurochemicals infect lung pathogens? I don't have any data on that I could find on M. hemolytica, Mannheim, but Sandrini and the rest have recently shown that if you take Streptococcus pneumonia and you give norepinephrine, what happens is you can increase the growth dramatically of the bacteria and at the same time increase their ability to cluster and begin to form biofilms. The question is, you have a commensal organisms within the lung, and you've been talking about the fact that stress can often affect that commensal population. Now, what would happen? We know from the gut that even just 2 hours of social stress in mice does this. This is from a heat map from sequencing by Illumina HiSeq a lot of bacteria in the gut, the whole bacteria that we could find. And we see that the important take-home message here is that when you stress the animals, you begin to change over the whole microbiota. The whole microbiota begins to respond to the stress, and now you have a different profile of microbiota. What happens in the lung? From what I can see in the literature, no one's ever looked at it, and it's not been done. But the take-home message is that everything is responding to the stress. The bacteria are reacting to the stress. There has been work done in Mycoplasma hypopneumonia, as well as others, which show that once you give them a stress neurochemical, they begin to change their mRNA transcript levels and change gene expression in ways we do not understand yet. We can even increase the rates of conjugate transfer between enteric bacteria, changing their antibiotic sensitivity. And one of the things we wanted to touch upon was that, as I said before, this is not a one-way street. So you produce the neurochemicals, the bacteria respond to it, and that's it. Is the brain knowing what's happening? In other words, I showed you before the map of the nerves going to the brain, that there's a vagus connection going, and that information goes up that way. Can the brain actually detect what is going on in a peripheral organ if it is a bacterial interaction? And a number of years we did this by actually taking mice, giving them a Campylobacter jejuni that didn't cause any infection, but yet it was a novel organism passing through the gut, and simply asked the question, did the brain see the bacteria going through? And what this shows is this is a map of CFOS activation in the brain in neural regions. This is the control. This is the animals that got, one animal, for example, we sectioned that we then gave C. jejuni. And what happened we saw was that the little black spots you see show CFOS neuronal activation, means the nerves are responding and knowing something's happening. And these are in centers that are concerned with anxiety in animals, anxiety-like behavior, nuclear tract solitarius and PVN and the rest. And what we saw was when we gave the bacteria, as it passed through, not even causing infection, the brain saw the bacteria and knew it was happening. And actually what I'm not showing you here is the brain then had anxiety-like behavior and then would act completely different than the other animals. Simply because the bacteria were going through, nerves were communicating to the brain that here are some bacteria, something's going on, and the animal's behavior changed. So what I want to, in a way, conclude with is giving you these two different ways of, this way of looking at it, where it's bidirectional, and say to you that if you look at bacteria as neuroendocrine organisms, can you approach certain disease states differently? And what that means is that the interactions of bacteria and the host with neurochemicals as a common pathway imply a long evolutionary pathway where mammalian hormones and neurochemicals first existed in bacteria. We have an evolutionary symbiosis implies that clinical conditions involving both the gut or the respiratory tract and the brain interprets where it interprets the signals can be viewed in a new paradigm. And by doing that, mechanisms can be identified and new therapeutic approaches then formulated. And the one I want to conclude with really here is one that is very big clinically on the human side, which is systemic inflammatory response syndrome, which is known as SIRS, which some of you may be familiar with, in which we have traumatically injured individuals who come in to the hospital and they initially improve, but then they start to go downhill. And they develop a hyperimmune response which results in organ failure. So one organ system after another begins to fail. And there's profound changes that go on the gut. It's often referred to as the undrained abscess. There's damage to the intestinal villi. And the important thing here is that there's been little improvement in mortality and morbidity with the use of immune-based therapeutics, that you attack the immune system on a hyperimmune response. Because I think what people are forgetting is that you have to think backwards and say, why is this even occurring? What's happening? And so if you begin to look at bacteria in this way and saying they respond to us and they respond to the neurochemicals. So, for example, with BRD, are they moving out into another area because they see the neurochemical signals and it turns on for them an evolutionary pathway to say, hey, I'm under stress now. I better do something different here in this environment. And so, how can you look at a disease state? So if you look at SIRS, and you know that in this case, what you have is stress, trauma, and the rest in the gut, and you have bacterial overgrowth occurs, and you have this altered diversity, what's referred to as the undrained abscess. I have put in this, what is the brain thinking? I've often said this to surgical residents when I used to be in surgical research at a level 1 trauma hospital, and I said to them, the patient is lying there in the bed, out of it. What is the brain thinking about what's going on in the body? And they looked at me, patient's not thinking anything. Patient's comatose. I said, no, the brain is running a program. Just like in your cattle, the brain is running a program. What is it thinking and what is it instituting? And so what the brain is thinking is that, hey, I have all these bacteria going on in here. I have to do something about it. What program will it run from an evolutionary response? It'll run and increase the immune response, which should hopefully take care of the bacteria in the gut. But what happens in the hospital? Well, the stress continues. Even though someone is lying there, and the same thing with the cattle, even though it's just standing there, the animal undergoes tremendous stress. And in the hospital, when we give, a patient pressors, meaning dopamine or dobutamine, we put people on ventilators, which make the lungs move up and down. Making the lungs move up and down mechanically is an incredible stressor and actually pours out neurochemicals in large quantities into the bloodstream. Parenteral feeding, when we actually feed parenterally, that's a stressor and causes neurochemicals to outflow. What then happens, of course, is bacteria in the gut see all these neurochemicals flooding through and they continue to grow, even though we're giving the people antibiotics which don't work. So what does the brain think that's going on? This slide didn't work very well. What the brain thinks is that if the bacteria are growing and my immune response wasn't good enough, I got to hype up the immune response. If I hype up the immune response more, I'm going to take care of it. But yet the stress continues. It becomes an endless cycle to the point that the immune response continues to such a degree that you begin to shut down one organ system after the other. So one thing that I've proposed on the clinical level, and people have been trying, is that reduce the activity of the brain, of the nervous system, calm down that part to calm down the amount of neurochemicals, and get the gut back with enteral nutrition and see if that helps. And there's been reports now that that does. So the take-home message that I want to finish up with is that the microbiota, whether in the gut or in the lung, respond to neurochemicals. And not only do they respond to neurochemicals, that they interact via the enteric nervous system or through the nervous system that is in the lung. They make neurochemicals, they respond to neurochemicals. That then hits the brain. This is a very interactive system. That affects behavior and cognition, which can affect even animals wanting to eat different foods. There's now different groups looking at the ability of the bugs in the gut to influence the brain, which actually tells the brain what foods it wants to have to come in. So it's known as the microbiota gut-brain axis. And whenever we think we're the first on doing any of this, I always like to find that we're not. And this one is out, which is The Psychic Life of Microorganisms, a study in experimental psychology by Alfred Binet. And all of you know Alfred very well and intimately, because you've all had experience with him. Alfred Binet is the father of the modern IQ test. And he actually published in 1888 in France that bacteria have psychic lives and respond. There's a little thing more newer that's just out this month on the microbiota gut-brain axis and the rest. And so I just want to leave you with that message that the bacteria are responsive organisms. We have to remember that the immune system is a reactive system. It's reacting to what's there. The microorganisms are there on first base. What are they responding to and why? So when we talk about cutting down stress, it makes, of course, a lot of sense, because otherwise, what are the signals that the bacteria are looking for to move out and then to cause disease? And with that, I'll finish. Thank you.